So let's get started. I would love to introduce our panel guests, Kim Tremblay, Lucy Kovalova-Woods, Nazret and Rashid Kashani. Welcome, friends. We're so glad you're here with us today. And so to get us started, as Lena's pinning all of us, what I invite you to do is, introduce yourself, maybe share a little bit of what you're comfortable regarding your experience or your relationship to arthritis, and where you're situated. And then we will get to the questions from there. So welcome.
May I start?
Yeah.
Okay, I'm gonna do it like both in French and English. So I'm gonna start in French for French-speaking people. Alors, je m'appelle Kim Tremblay, j'habite Montréal. J'ai été diagnostiquée, ça fait peut-être 1 an, 2 mois, R8, l'arthrite rhumatoïde. Donc, je suis quand même assez au début du processus. Mais quand même, j'ai joint CAPA parce que je trouvais qu'il n'y avait pas beaucoup de représentation francophone dans tout cet espace arthrite rhumatoïde. Donc, mon but, c'est vraiment créer du contenu, puis créer un lien avec les communautés francophones pour pouvoir partager les connaissances et les expériences. So, my name is Kim. I'm from Montreal. I've been diagnosed a year and something ago. So I'm fairly new to this journey. I joined CAPA because I wanted to increase the Francophone presence in the community and being able to push for better alignment with the Francophone community and having not just a translation of what we do in English to French, but having really a conversation in French with the French community. So that was my goal.
Merci.
Merci.
Yeah. Who's next?
I'll go. Thank you. Thank you very much for introduction, Jenny. My name is Lucy. I'm joining you from Calgary, Alberta. I've been officially living with diagnosis of rheumatoid arthritis since 2022, unofficially probably longer. I proudly serve on CAPA board. I participate as patient partner in different projects, and I love it. And I really appreciate this opportunity to share my experiences through this webinar as well. Thank you.
Thanks, Lucy. Nazret, I thought I overheard you.
Yes, Lucy beat me to it. I'm a fellow Albertan. Lucy and I are both from Alberta, but I am from Edmonton, which is Treaty 6 and Métis Region 4. And my pronouns are she and her. And I'm I have arthritis. My mom has arthritis, my brother. So basically it's a family affair with arthritis. And we are all diagnosed, but we don't have any treatment. We don't have any access to anything that would make our lives easier or better, except for my brother. He's taking medications for his anyway. But so I had a lot of questions when I got diagnosed, and my family doctor's response to my diagnosis was, everybody's got arthritis. If you have any pain, I'll give you painkillers, and and that's where our conversation about arthritis ended. But since I knew that my mother also has all those arthritis, osteoporosis, arteriosclerosis, and I'm thinking, we're in trouble. Something needs to give. Something needs to happen here. So I had lots of questions, and I came across patient partnership with someone, a researcher in Alberta. And then I came across CAPA as well as patient partners, patient family advisor, and a lot of like my mind is blown and enlightened, because there's so much information that's coming from CAPA that I really appreciate, that otherwise would not have come easily to me. And so I appreciate that. My question is, what are we going to do? What are we going to do with the barriers that are set for people like myself that are BIPOC, Black, Indigenous, people of color, that are impacted by barriers in the healthcare system at every level, in every way, in research, in clinical settings, like a family doctor, in access to treatments. We're gaslighted. Our concerns are not taken serious, and we're barred from accessing quality, timely care and treatment. And so I'm hoping that CAPA will help me out with getting to the bottom of this and kind of changing the situation somehow and putting it to the light and addressing it. I do appreciate CAPA putting me together with other amazing panelists about arthritis and pregnancy. That it's a big issue for Black women. And so I appreciate you guys putting me there and allowing me to express my opinion and my experience with what my neighbor went through and my fellow co-host there that also expressed her concerns because she experienced themselves firsthand. And so, yeah, thank you so much for having me. I look forward to this meeting. Thank you.
Thank you so much, Nazret. So far, the three of you have really talked about, and then Rashid, I will get to you in just a sec. I just wanted to really to acknowledge that, thank you for making the invisible visible, right? Your experiences with challenging your experiences with having challenges with access, your experiences as people from marginalized groups, immigrants, people of color, Francophone. So it's and beyond. And so that hits home to me as well. That resonates a lot with me. And I think, and so thank you for all of you for being part of this conversation. All right, Rashid, come on. Let's go.
Okay.
Welcome.
Thank you. I'm Rashid Kashani. I'm an occupational therapist with 29 going on 30 years of experience. I occupy a lot of roles, but one of the longest ones that I've had and one that I keep coming back to, and that's what kind of drew me back drew me to working with CAPA was I've been working with a rheumatic disease unit, a dedicated rheumatic disease unit since 2001, but I've also been interested in serving populations living with arthritis, going back to actually my very first experiences as a student working at the Bow Valley in Calgary. So we have a pretty Alberta heavy panel apparently. I am located out of Edmonton, but in any given week, I'm typically serving a lot of areas outside of Edmonton. So we're talking like Treaty 4, 6, 7, and 8, sometimes even within the same day. My master's and my PhD were both focused on research and evidence-based practice with serving people with rheumatoid arthritis. And I also have a spouse that's been living with rheumatoid arthritis for the past 15 years.
So thank you, Rashid. So you come to us not only with your clinical expertise, but some like the personal expertise too, because we can't discount your impact as a caregiver. So
Yeah.
thank you. Your impact or experience. So I'm just trying to figure out how to, I would love to hear, a number of us we've been relatively newly diagnosed, right? Kim, you were diagnosed within about a year ago. Lucy, you said you were officially diagnosed only a few years ago, but you suspect that you'd been living with it for a while. And Nazret, I can't remember what you had said about.
It's been a while. It's been definitely before COVID, like maybe 10 years now.
Okay.
Yeah.
So, would you mind sharing? I'm going to start with Kim. Would you mind sharing what your experience has been in trying to get a diagnosis? What have those challenges been? Who did you rely on, like with resources and support?
I cannot complain because didn't have to fight at all. I went to my it happens. I went to my family doctor. I thought I had carpal tunnel syndrome. My wrist was painful. My hands was painful. So I thought it was just carpal tunnel. Went to my family doctor because I have a family doctor. I'm one of the lucky few who does. And I looked at my hands and said, "Well, I suspect it might be arthritis." So he sent me to do some blood tests or, tests and everything. And the way it works in Montreal is that when you receive the results and you just check all the criteria, I guess, you register to a central where they're going to assign you with a specialist. So he just filled out all the form online, and I received the answer for like 2 weeks afterwards, saying that they didn't have any specialists for me, so on and so forth, and I was on the waiting list. But there was a phone number at the end of the letter, so I called them. And I said, "Well, there's no such and such in this area. Is there by any chance some late cancellation?" And the guy at the other end said, "Well, no, I have something for you." And within 2 months, I had my appointment. So I didn't have to fight to have my diagnosis. The only thing I could tell to people is just don't be shy to call people. Don't be shy to call. If you're just waiting to have answer, and just don't be shy to pick up the phone and the call, and that's gonna help you greatly.
Yeah, thank you. You're a unicorn, I think, with
Yeah, I
both
guess
your,
so. I'm
you know,
blessed. I'm
yeah,
blessed. Yeah.
yeah. Lucy, so you'd said that you were unofficially, you were officially diagnosed, but and you said you'd felt like you'd lived with RA for much longer than that. Um, what do you think the delay was with respect to getting that diagnosis?
Well, in my case, delay was I was in the wrong place at the wrong time with my first symptoms. I was back in Ukraine. I went to doctors, to two private clinics that's supposed to figure out what's wrong with you easily. I was run through numerous ultrasounds, MRIs, tons of lab work, like 3 specialists. And at the end, neurologist looked at me and said, "Everything is good with you. You just have anxiety. Here's pregabalin for you." I'm like, okay, so silly me, without thinking something wrong, or happy that nothing is wrong, at least on the pain wasn't that bad at that point. I went home, took that pregabalin, and forgot about it for some time, at least until I have to move 2 continents, 3 countries, landed in Canada, and 2 months later, I was in bed with severe pain. And it was coming back every 2 or 3 weeks at first. And then it became quite regular when my husband looked at me and said, "No, I'm calling family doctor." And I was very fortunate. The family doctor was nurse practitioner. My first family doctor, she wasn't dismissive. She looked at me, she sent for the lab requisitions and everything, like x-rays. And pretty soon she got results. She set me up with initial methotrexate and something else, and she sent referral to rheumatology. And I was fortunate, just came to get into a rheumatology appointment within 2 months. So wrong time, wrong place. In my home country, unfortunately, rheumatoid arthritis is 99% accepted. Like, oh, it's okay. Everybody gets the arthritis. Take Tylenol, and here is diclofenac cream for you. That's it. That's how it works. But here in Canada, I was fortunate to get to the right family doctor, I would say, and that even led unofficially as a refugee. I didn't have language barrier because my English was decent to communicate. Because I know a lot of my countrymen, men and women, complain that they are not able to find right help because language barrier. so you can't explain medical terms or what you experience very well, or you basically get dismissed because of the accent. That happens too. So there is a lot of discrimination to newcomers, unfortunately, and that's just the reality that we're hoping to change.
Thank you for that. And thank you for bringing up, for addressing that, so the privileges that we've had in order, like that we've had that have enabled us to seek and get care, like compared to, say, some of your other country folk, right? Like with the accent or with the language or with education. Nazret, I suspect that you've got a very different, I'm looking at you going, I think you've got a very different story to tell with respect to how you, like your process with getting diagnosed. And I know that you talked about a little bit in your intro about how challenging it's been to even receive treatment.
Yeah, but I totally understand where Lucy experience came from. Women in general get dismissed, and it's international, as Lucy just said. It's happened in our country. It happens here in Canada, and it's just yeah, and I feel for you because I totally agree. We women, regardless of whether, what color we are or what ethnicity or religion or anything, orientation or anything, we do get dismissed in general. And I'm glad that your husband was there to help you because having there somebody with us mitigate the situation and helps us quite a bit. For some of us that are able to have somebody with us when we go to those interactions with the healthcare system. But yeah, you're right, Jennifer. My experience, well, I don't get any treatment. I was diagnosed because I had back pain, and back pain can be anything. So we did X-ray, and I had to fight for the X-rays. And then he found out that, like I have, arthritis. And same thing for my mother, who I'm a full-time caregiver to. She's might be frailty, but they're gonna ignore it because they think it's old age and dementia and all that stuff. But then when we did the X-ray, we found out that she has all those arthritis-related conditions. And again, we have never been referred to rheumatoid, professional or specialist, and we've never been recommended for anything to mitigate the situation. But as a patient family advisor, I've been doing the literature review to look at what is happening with the treatment or a diagnosis of Black people with arthritis. And it looks like it's a very common knowledge, very well-known situation where Black people are not getting access to healthcare that easily and have delayed, treatment, if at all. And we're more likely to have, arthritis of the knees or all those things, and not the hands, like carpal tunnel syndrome or whatever. No, that's not more likely for us. And I think it has something to do with the fact that we Black people are usually engaged in, work that is harming the body physically, and we're under the poverty line, so we have jobs that are more likely to not have accommodation for disability like arthritis or anything like that, and are less likely to be assessing for work-related injuries and mitigate that and prevent that. And so yeah, it's a very known fact, all those things, and yet there is no knowledge translation and any pathway to mitigate those situations that we're in, to avoid that delayed diagnosis, that delayed treatment, and severe outcomes for communities like mine.
You bring up a lot of, how to address systemic barriers and systems of oppression in 50 minutes, right? And I'm not to say that, not to minimize this. it is insidious and pervasive. The stigma, the assumption, the built-in the built-in racism in the medical system, right? And I know that, and I think CAPA can back me up on this. I know that very recently there was an article that was published on RA and Black men's experiences. I think Therese and possibly Don Richards and Desmond Williams were among the authors of that paper. So at the very least, I know that CAPA is working towards addressing what we can about what we can. Again, that doesn't mean to minimize your experience and the experience of your family and loved ones, because it's hard. And you make an excellent point for the roles of the advocate and patient partner that all of us have been taking up, all of us. And so I appreciate your presence here, all of you. Rashid, I'm curious. I mean, having listened to these stories, and I know that you've heard a lot of stories over the 30 years of your career, and including your wife's. I'm curious, because of your dual lens, what comments you have about that, like what you're, yeah.
All of this is really hitting home in terms of I've unfortunately or fortunately heard these things a lot over the years, especially in terms of access to treatment and being believed about the initial symptoms and how that can lead to things like a delay. And there's also, I think, a knowledge gap as well that needs to be addressed, and not just in my own profession, because I think mine is actually one of the better ones at listening to client stories and narratives and wanting inclusion more so than maybe some of the other professions, but I'm not here to slam them. One of the things that does kind of come up, I think, quite often is I think we sometimes get ourselves as clinicians lost a little bit in, okay, we're going to focus on like just one thing. Like we're only going to focus on the reason for referral was, say, in my case, it might be for a splint or it might be for foot orthotics. But if we're not considering like where this person lives or all of the roles that they might have, and they might be unique to that person just because of who they are, their cultural background, their religious background, we need to start asking, I think, deeper and deeper questions. And that's why even though, especially if I am working kind of in the public health system, there are standardized tests and assessments that they want filled out. But I do keep it kind of a lot more narrative. And I think that reinforces for me. And I mean, when I talk to my fellow clinicians, that's one of the things that we need to make sure that we're focusing on is what is your story? Like, what is it that, like, why are you here in terms of, why did you come in today and what is it that you need to do, want to do, have to do, rather than, okay, tell me what medications you're on. We're going to get to that, but maybe that's not the first thing that's top of mind. Sometimes I find, and again, that's usually when the tears start, is because I'm the first person that they've seen in months or even years before they get their diagnosis who's actually asked them that question to say, like, what is it that you need to do that you're not doing? What is it that's most important to you? And I mean, I may have even some preconceived notions. Like I had one person not that long ago who she couldn't bathe, she couldn't dress. That's not what she wanted. She wanted me to develop her a little stylus so that she could tap away on her computer and write memoirs because that was her main focus. She didn't care about the fact she couldn't bathe or dress. She says, my husband helps me with that. That's some intimacy for us. Don't take that away from me. I want to focus on this. So I think, taking a step back and just kind of going, what is it like that brings you in? Not just, hi, I'm Rashid, I'm your occupational therapist for the day, right? It's no, what is it that is bothering you the most right now? What's the priority for you? What's the meaning? Where's the meaning kind of missing for you right now?
Right.
And I think that's kind of one of the things that all health professions kind of need to focus on a bit more. It's at least an important first step towards better inclusion, better equity, that sort of thing.
Yeah. Yeah. Thank you for that, you unicorn clinician. Uh, so I guess the question is, or one of the questions that I have is I mean, I get a sense here that all of us on this panel are very good at expressing what our needs are, right, to the right people. And I mean, and part of it, a lot of it, what you said, Rashid, is about, and all of you have said there needs to be a culture shift with respect to um, how how to build partnerships between clinicians and people who are living with these and their loved ones who are living with these conditions. And so I guess my question would be, well, one, actually, do any of you, Nazret, Lucy, Kim, do you have any thoughts or comments to what Rashid was saying and whether or not your experiences were similar or different with any of the healthcare professionals that you worked with or tried to partner with?
Well, I can start if you don't mind. Well, I think my personal experiences were quite different. Even here in Canada, I'm on my family doctor number 4. The first one went private, so that was it. The second one went private. And the third one was dismissive of any sort of pain. So renewing prescription for basic painkiller when I also have other conditions like fibromyalgia was impossible. So that did work out. Now I'm on a family doctor number 4. And this young lady is amazing. She understands what pain is. She was the first to mention to me, if your average daily pain is 4, let's add this and you'll get to 1 or 2. I'm looking at her. That was first visit. First visit, she just looked at my chart and that's what she said. And she will ask right questions with the right tone of voice, with the right intonation. And you really see that the person is interested to hear what you want to share. I think that's important. As Rashid said, listen and understand the story. My first family doctor was right to just check everything, check direct questions, and my newest family doctor, she is good at it. But when the person doesn't want to hear about your basic concern and you go home with nothing, that's just discouraging because you still go home to same symptoms and same experience, the same daily routines that you can no longer do. And without any explanation, without tools to manage it, it becomes really too heavy.
Nazret or Kim, anything to add?
Now, I understand that Rashid is in Edmonton.
Yes.
I think we're going to have a relationship here.
Okay.
Patient,
Fantastic.
caregiver, provider.
Okay.
Because you are a unicorn. Like I've never seen a nurse practitioner or family doctor that was interested in listening to anything we have to say. Like like I said, getting the assessment and finding out that we have arthritis was a struggle. Once the diagnosis is there, we just are dismissed and like, oh, don't worry about it. Everybody's got that. In my mom's case, they should have done something about all those arthritis-related conditions because it's going to make her quality of life less likely to exist. With all those other things that are happening, but everybody ignores it. So, and I didn't know where to go with that. I didn't know why she has all those things in the first place. So that was a shock. Nobody helped me with understanding why this is happening, what I can do as a caregiver, and nobody wanted to mitigate the situation. So this is my experience. Our experience for my family has been completely different. In terms of having a good engagement with a nurse practitioner or family doctor in regarding to arthritis. And and I wonder why, and how can we have more of Rashids in the world, in Alberta, in Canada. And whatever we need to do to duplicate you, Dr. Kashani, let's do it.
Okay.
My experience is a bit different, as I said. Well, when I went to the test, what I wanted to face that when I started having the test, my RF factor was 120, and I guess the average or the normal would be 20. So I was clearly sick. So I didn't have to fight to prove that I was sick. So when I went to my rheumatologist, I mean, he's a specialist. So in my mind, I I had to prepare myself. I had to like own this. So I read it, it was a crash course to me, crash course in biology
Right.
and science and everything and medication. And I prepare the same way as when I had to presentation to VPs or to important people at work. So I had the same methodology when I go meet him as when I go present to presentation to a VP in my job. So that's the way I approach it. Doesn't mean that I necessarily challenge what he says, but I like to arrive prepared. And what's important for him is how the disease affects me in my daily life. Am I able to clean up? Am I able to cook? Am I able to work or to get to work? So if you take note of everything that you cannot do, that's going to affect how you function. I figured that I was listened to, actually.
Yeah, those are excellent points, I think.
Yeah.
Because my experience has been with other clinicians and healthcare providers and allied health is that how has my daily living been impacted? How has my driving been impacted? How have my activities, getting dressed, etc. But also Rashid spoke to a really great point of like, what is most important to you? What's your
Mm-hmm.
priority? What are the things that give you meaning? And I it's listening to all of you talk, I know that we've done, and I know that a lot of us in the community in the CAPA community have done a lot of self-learning, self-teaching how to become the advocate that we need for ourselves because nobody else is going to be able to do it. How can we really, I don't want to say force, but how do we really carve our space in those clinician rooms? And Kim, you started listing like some really great questions on how to communicate in their language, right? Like talking about assessment, talking about impact, talking about function. I'm wondering, because we've done a great deal of self-learning, what resources that you have leaned on that have taught you how to advocate for yourself, how to talk to your clinicians better so that your needs are heard. And I'm going to extend that invitation out to uh, our CAPA community to put those in the chat because I really like the idea of, and so, sorry, I talk a lot and I talk fast. Um, Thank you for putting those articles in the chat, the ones that I referred to. I really love the idea of creating resources from these webinars that can be shared so that it's still all in one place because I suspect that we've all got our own tips and tricks and tools in a tickle trunk of like how to best advocate for ourselves. So sorry, that was a very long question. My question is, what resources were helpful for you to learn to talk about your lived experience with your clinicians?
Well, actually, I took knowledge I got from my corporate life. I mean, I had some professional development training, so I took a lot from it, how to be assertive, how to present yourself, so on and so forth. So I really took all this background, how to present, how to make a presentation, how to communicate, and used it towards my specialist. And always in my mind, always bear in my mind that this is a man who's been to school for, I don't know, 15, 30 years. So I mean, he's at a certain level of being thorough and being, really square, so to speak. So you really have to adapt to that type of thinking. I mean, from my point of view. So this is what worked. So I don't know if there's something equivalent for patient. Is there any resources or coaching or article we could that exists actually that could be helpful for other patients?
So I'm a member of the patient and family advisory group with Alberta Health Services, and they do give us education, how to engage with the healthcare system, with the healthcare provider. I feel like we should do it the reversed way. We should do a webinar or education for healthcare providers on how to talk to patients and to be more patient-orientated and patient-friendly and caregiver-friendly. So yeah, I felt very uncomfortable with applying what I was learning because I had to change my ways and I had to control my emotions. And I'm not sure that is my authentic self. And I want to be myself when I'm engaging and not be scared that I'm going to say or do the wrong thing based on those education modalities that I'm getting educated by. So yeah, I appreciate the education that I received to be a better patient when I'm engaging with the healthcare system, but I would like the other way around, or a balanced way of doing things and not put the burden on me as a patient and caregiver. Yeah. So
Yeah, I could see Rashid nodding when you said that, Nazret. Um, and that and I absolutely agree with you that we have to be chameleons in so many ways. We have to be shapeshifters, and sometimes we have to really, like as you said, not show up as your authentic self in order to get yourself heard, which I find kind of ironic. Um, Rashid, so I mean, how what's tracking for you in this part of the conversation, right?
Well,
Like, how did you learn to ask the questions that you do?
you know what? It's kind of weird. I had a lot of really bad jobs before I became an OT, like a lot of service jobs, like low-level service jobs, you name it, bussing tables, washing dishes, retail, the whole bit. And one of the things that you kind of have to do to survive in those situations is you do have to actually listen to absolutely everyone that's coming in the door. And I found that even as a, because I was doing this even as a student therapist, having those kinds of things and honing those skills made a really big difference. But it also came down to like listening to patients because I had a number of them tell me, and this is like long time ago, but one of the patients that I had when I was working in Calgary at the former Bow Valley site, which doesn't exist anymore, was she pulled me aside and she goes, I'm brought out with just about every student that Denise takes on, and she takes on several a year, and you have been the first person that's actually listened to me. And that really stuck with me. And it's also kind of getting feedback, even as recently as a few months ago, where I had an older client who'd been living with RA for quite a while, and he'd come in just for something really specific with one of his hands. And I'd finished working with him, and he goes, I want to thank you for being the only person who has actually made eye contact with me and talked to me while you're here. And I kind of was taken aback because I mean, I like to think that a lot of my colleagues are similar, and we work at a teaching hospital because we're the best of the best. But I turned around and I kind of looked around the treatment room and went, absolutely everybody's interacting with the electronic medical record and not with their patients. And yeah, and for me, it was kind of because I feel kind of slow and stupid because I can type and I've been using a computer since I was 13. But what I typically do is I've got some weird habits. So it does take me a bit longer to kind of get the charting done because I like writing these really long, enormous narrative, non-oppressive notes. And I mean, even my professional association's got a webinar coming up called Non-Oppressive Charting because
Nice.
we're getting more oppressive. Um, But I kind of looked around and thought, like some of the clinicians that were about my age were struggling to use the electronic medical record because it's not the easiest thing in the world. And the newer ones, like that's just kind of one of their main modes of communication. So I think kind of universally we've been losing a little bit of our skill set, even those of us that kind of come by it a bit more naturally or honestly. I think the electronic medical record is a bit more of a problem. And it gets to be, I think, more of a problem when we're talking about, the inflammatory arthritides in particular, because usually people are referred for a hand splint or foot orthotics. There are other things that maybe have not been picked up by the referring doctor. We want to make sure that we're kind of trying to deal with everything in our 60 or 90-minute appointment. And again, I think that's one of the other things is we're kind of being instructed to cut our appointment times down and see more people. And I'm going, I can barely address everything. Like I want you to come in, get what it is that you came in for, make sure you're leaving with it if it's something that we're building or making, but also make sure that we're addressing all of your other questions as well. 90 minutes is just barely enough time. Unless we're talking like a single finger ring splint and it's for an adjustment or something like that. But usually we need to be taking, I think, a bit more time. That means, though, that we are going to need to expand the number of appointments we have because I'm a big believer in early access and early intervention. We don't have enough people to kind of provide the right amount of care and the diagnosis specific care as well.
Yeah,
It's all resonating. Yeah.
yeah, and also working upstream is really resonating with me, and upstream of like of in medical schools, in education and in research. It's yeah. Um, whew. So Lucy, do you have anything to add?
No, I think we could just go to next question.
Okay. I think we're just jumping around because you each bring up some really important things, and I think that we don't cover the questions that have come up in our original conversation per se. I would like to give some time to the questions that have come up from our community members, if you don't mind. So, but first of all, I'd like to know how receiving a diagnosis impacted your experience of living with arthritis. Was it important? Did it make any difference in how you saw yourself, how you interacted with the world?
Well, I can start. I think the best part to me is knowing what I'm dealing with. And the cause, the consequence, and the treatment protocols. But it's just my mind. I need to have explanation to things, understand things to start dealing with it. And when you don't have explanations, it's kind of you're in the middle of nowhere. And having that acknowledgement that you have diagnosis and you just need to learn to deal with this actually gives you the direction where to dig in, what to read, and whom to reach out to, and that was extremely important to me. And when it was reaffirmed with first treatment protocol beginning to work, and the rheumatologist was really, really well explaining things very well and also listening well. So that's important, yes, extremely.
Yeah, thanks. It's one step towards validation, right? Increasing validation. Kim, what are your thoughts?
My thoughts on how do I live with it?
How receiving a diagnosis has impacted your lived experience?
Receiving it totally changed my life. I never thought it was that life altering, from the this disease itself to the medication and side effects of the medication. It totally changed everything. And I never thought it would be so present in my life. Either it's the pain, or either it's the medication, either it's just coordinating everything from appointments to getting the medication from a renewal and everything. I consider myself fairly organized, and yet it takes a lot of a lot of time. It takes a lot of resources just to deal with it. Yeah.
And it also sounds like it impacted your sense of identity, if I may go so far.
My sense of identity, it's challenging. It's really challenging because before I was very active.
Yeah.
Now I'm not as active anymore. So even my group of friends, the way I socialize, I really have to manage my energy. So yes, it's humbling, let's put it that way.
Yeah. Thank you for that. And Nazret, I saw you nodding as soon as I said identity.
Oh yeah. No, everything that has been said so far resonates with me as well. But giving it a diagnosis shocked me. I didn't expect myself to be someone that would get arthritis, but once I got that diagnosis and the shock of it, I kind of understand myself better and what I can do with my body and what I can't do and what to eat and what not to eat. So I went on Dr. Google right away and tried to find out, okay, how do I take care of myself better? How do I make sure that I don't flare up anymore and I don't have, so I live by what to avoid in order for me to live with arthritis without symptoms or complications or flare-ups. And that helps me a lot. And I also relate better to other people around me at work that have arthritis themselves and self-medicate with 500 pills a day or whatever to mitigate the pain and instead of getting the treatment that they need. And so I have like a talking point like with them like we can talk about things that all of a sudden we have in common, which is arthritis. And yeah, so it's changed my life quite a bit, the diagnosis. I feel like for the better because I will try to take care of myself better because now I know what it is that I have. And I also plugged into the network, the arthritis network, like CAPA. And I'm very appreciative for having that connection and helps me with understanding myself better and arthritis and the arthritis environment in Alberta in Canada. So yeah.
Yeah, thank you for that. That all of what you've said so far has really resonated with me in that information is agency and power, that there is something incredibly validating about and also identity altering in receiving a diagnosis. And there are places, even with the diagnosis, there are places of finding unexpected connection and community, which I've also found in CAPA as well. So thank you for that. Rashid, I am curious, like, I don't know how much you're able to disclose about your wife, but I want to hear about your experience as the spouse of somebody who's living, if you're open to that.
She did give me permission.
Okay.
Um, honestly, there was a lot of relief, mainly because when I first saw what her symptoms were, I was really suspicious. And I thought, well, okay, you're working on a PhD on RA. You've worked in RA for a long time. Are you just kind of being a hypochondriac and seeing rheumatoid arthritis wherever you look? But this isn't adding up. So I'm lucky. I sat down with a bunch of friends, mostly physicians and therapists, and said, okay, guys, let's put all of our options on the table. What could this be? And we came up with three diagnoses. Two of them
Wow.
were fatal, and the third one was RA. And I said, well, I've never wanted somebody that I loved to, have RA as a put. I said, I guess it's better than the other two options. We were lucky in that we both had the same family doctor who we've had a long relationship with, who also happens to have a rheumatologist who works part-time at the family medicine clinic that she works at.
Right.
So she got in record time and she got on DMARDs right away and failed upwards on most of the DMARDs and got on biologics. I think if I look at the timeline, it was like 6 months from onset of symptoms to diagnosis. And because I was attached to the program and it was kind of weird, she requested referral to the rheumatic disease unit so she could go through the rheumatoid arthritis specific program. All of that was done within a number of months or weeks, and she had bad communication with this rheumatologist, so we were able to actually get her into one that works a lot better with her and has actually worked, I think, much, much better with her. But there was a big shift because I can't be her OT and her spouse. That was really a big learning curve for me. And having to basically defer to one of my other colleagues with specialty in that area, who I didn't always agree with, but it was like you need to set those boundaries, otherwise you're gonna go off the deep end. And it was also kind of like looking at evaluating what was most important to us. So, yeah, she still synchro skates and curls and does a bunch of other stuff, but that also means that somebody's got to make sure that she's got energy to do those things. So somebody's taking over all of the, meal preparation, and we're hiring people maybe for housekeeping or something else because I don't have time to do that as well as all the other stuff. Um, so it was tough at first, kind of changing roles. And because we were both quite a bit younger when this happened as well, it's like, well, okay, that kind of changes maybe some of our travel plans a little bit. Like we need to book in extra days because you're going to have really stiff joints. It also means we're going to have to upgrade to much nicer seats on the plane. So we'll be saving money a lot more to go on trips, and maybe they're going to be a little different. But I think one of the big things was it did kind of cause you to kind of take a step back and go, okay, what is most important here? And also having quite frank discussions at times around like, well, are you going to keep taking that medication or not taking that medication? And, okay, is it time to go and see the therapist, or is it time to basically go back and talk to the rheumatologist again? So it sometimes keeps rearing its head, but because I think we were really lucky and had privilege and had like a lot of resources to basically help us out, we've had a much different outcome. And so, I mean, she's even gone and talked to people who have said, well, I've got RA, I can't do this, I can't do this, I can't do this. And you said, well, not necessarily. Like you can, but you have to kind of have things fall in place for you. And you also kind of have to make that a priority because once the pain was under control, and the pain's been gone, basically. I mean, she's got
Well,
big problems with osteo in her toes now rather than anything else. But the fatigue has been a big factor. And that's one that I was aware of ahead of time and knew like probably going to be dealing with fatigue as kind of an ongoing issue. And so that's kind of, I think, the one that kind of keeps up being a little bit of a problem at times. Like we kind of have to say, okay, well, maybe we've done too much this week, or, okay, we tried that. Maybe we don't do that again, or maybe we do it quite differently. You've got to make sure that you're talking to each other a lot, though. Yeah.
yeah. Thank you for that perspective. I
Yep.
think that um, there was a really great question on, there was a great question from one of our like from our community members that asked about like how do you manage being a caregiver and then having to take care of a patient, and I don't know whether it was from the perspective of somebody who lives with arthritis and they are caregiving for somebody who lives with arthritis or both. But thank you for addressing at least part of the challenges and how you are working together to to like manage and navigate it. We have 2 minutes left and so many questions still, which unfortunately we weren't able to get through because this I hope that this conversation was as rich for you as it was for me. Um, so I'm going to ask you to share maybe, I don't know, 30 seconds of how you are doing now and what you hope to see, and then I'll pass it on to Lori. Can we start with Nazret?
I appreciate having a voice in this space and shedding the light on the issue of barriers during diagnosis. And what I would like to see is let's spread the spread the information, how to navigate the system, how to have earlier diagnosis, and how to have better treatments. Let's help each other in our space, in our community. and let's change make so that the healthcare system does better for arthritis.
Right on. Thank you, Nazret. Kim, I saw you leaning towards.
Yeah, what I'd like to do is to share all the wonderful information and knowledge with other community throughout Canada. Either it's the French community or other community newcomers, to spread the knowledge within those communities, so they gonna be able to better fight for themselves.
Yeah, thank you. I appreciated your message about alignment and partnership. Very
Mhm.
early on. Lucy, how about you? How are you doing?
Well, I want to thank for everybody listening to me, to my bumbling about the experience. It has been difficult, but officially my RA is currently in the remission. So I'm dealing with some other comorbidities, unfortunately, but that's a different story. Instrumental to me was when I just got diagnosed, finding CAPA, finding amazing people like Lori, like Linda, Jenny, everybody on the board and in the community communicating. It taught me how to accept myself, how to deal with daily tasks, and how to communicate with my husband and my medical team more effectively. It meant a lot, and it still does. Thank you.
Thank you. Rashid, how are you?
I'm great. So this is very energizing, and I'm really happy to be part of this. Definitely helps confirm my practice, but also gives me some things to think about in terms of things that need to be focused on here and elsewhere. Um, just a few resources that people might not be aware of, but depends on how much you're willing to look internationally. But because I did all my training across the pond, I know that the NHS or National Health Service in England has a number of additional evidence-based resources that people living with rheumatoid arthritis and other types of arthritis would probably be interested in looking at as well. Free, open access, evidence-based. It might be a good place to start for somebody who's just looking for some general information, especially about daily living activities.
Thank you. Thank you to everyone who's commented and shared a little bit of your stories in the chat. I'm sorry that we're over, Lori and Carol. All of this it's recorded, and as I said earlier, that there is going to be some takeaway keynotes, and all of your comments and questions in the chat and the resources will also be captured in this resource. Thank you, Nazret, Kim, Lucy, and Rashid, for being with us today. I appreciate you so much, and so does the rest of our community. I'm going to pass it on to Lori now, and then Carol. Thanks again.
Yeah, thank you so much. Yeah, it's super.
Thank you, Jenny.
Thank you, Jenny. Yeah, because we're not saying thank you, back to you. I know Kim is. So thank you so much for moderating such a great discussion. It's great to just sort of sit back and listen to you all share your pearls of wisdom. That's for sure. I really am happy to have you all part of the community as well, and trying to help do better for everyone else living with or affected by arthritis at the end of the day. So as I mentioned, in the agenda earlier on, we'll kind of proceed now to a physical activity kind of portion, just to kind of transition us from this like super interesting panel to our AGM, which might be a little more dry, I admit, sort of at the latter part of our meeting, that we'll reserve our last 15 minutes or so for, but it's really my privilege to introduce Carol Reese, who will be bringing us through all of the 15 minutes of physical activity. Hopefully we'll feel reinvigorated and refocused, so you can focus on the perhaps less interesting part, which is when we come on to talk about like what we've been doing over the years. So Carol Reese lives in Ottawa like I do, and lives with spondyloarthritis. So she's a certified yoga instructor. And so with that, I'm really just going to pass it on to her. I'm going to remove the spotlight on our various speakers, and then we'll hear from her.
Can everybody hear me okay? Okay, so with this, every pose can be modified. So move within your range of movement. If you're feeling pain, then it's too much. Don't do it. It's your 15-minute practice, and I'm going to get the music going. So if you just sit comfortably on your chair, and if your chair does have any wheels, I don't know if you can lock them. Just try to be safe and not roll away or anything like that. Okay, so we're gonna go first into seated mountain pose. Just put your hands on your lap, and we'll just take a few breaths. Inhale, a deep inhale, and exhale through your mouth. Again, a big inhale, big exhale. And the next one, try to let out a nice big sigh. Again. And you can close your eyes, go back to your normal breath. And now we're going to do cat-cow pose. Again, your hands on your lap. And open your chest, inhale. Exhale, chin down to your chest and round out your back. Inhale again. Cow, open your chest. Exhale, round out your back. And keep doing this at your own pace. There's no rush. Do this 2 more times. And now we're going to do a seated twist. So just put your left hand on your right thigh and gently twist to the right. And again, very gentle. Do it within your own range of movement. And just look over your right shoulder and stay here for 3 breaths. And now exhale, return back to center. Inhale, repeat again. Go to the right.